Hello everyone, this is Dr. Sandeep Madaan. I am anatomy faculty at NEETMDS, and we will discuss recent FMGE exam questions, and these questions are recall based, so you might find somewhere maybe the language of the question or one or two options may be different from the exact exam that you have already appeared for. So in that case, you can always contact me on these details that I am sharing with you. That is a Telegram. If you are on the Telegram, you can use the Telegram to contact me, or FB and Insta ID also I am sharing with you guys. So in case you find any discrepancy or any difference, you can let me know, and in that case answer may be different. But on whatever recalled questions that I have got, based on that I am going to do the discussion now, right? So let us start. This is the question number 1, where we can see question was asked with the image where one hand is seen on the lower limb part, particularly at the posterior aspect of the leg, where this artery pulse is being taken. The question is which artery? So to understand this, answer to this question is posterior tibial artery. And to understand this part here, let us discuss the anatomy behind it, and let us see. So this is the popliteal fossa. So in the popliteal fossa, as we know, this is a diamond shaped fossa, and the artery present in the popliteal fossa is the popliteal artery, which is in continuity with actually a femoral artery. And the popliteal artery itself, it will divide into two branches, that is anterior tibial and posterior tibial artery. So we have anterior tibial artery from the popliteal, and we have another branch, that is posterior tibial artery. Posterior tibial artery, further it will give one more branch here. The name of the artery is, this one is peroneal artery. So basically now we have got 3 arteries, and in the leg we have 3 compartments, right? So anterior tibial artery is for the anterior compartment. It will take care of the anterior compartment of the leg. Posterior tibial artery is the artery of the posterior compartment. Similarly, peroneal artery is the artery of lateral compartment of leg. Okay, so they will be taking care of respective compartments. After that, when they approach the foot, like this, you can see the posterior tibial artery, which is running in the posterior compartment, it will be reaching the plantar aspect or the sole of the foot, where it will be giving plantar arteries, in the plantar aspect of foot. And this anterior tibial artery, which is traveling in the anterior aspect of the leg, will be reaching the dorsum of the foot, and in this part it is going to give this branch here in the dorsum of the foot. This particular vessel we check the pulsation for the peripheral vascular disease. And what is the name of the artery? This is dorsalis pedis artery. This is dorsalis pedis artery. Okay, so now these are the vessels in different part, and in this given picture, this particular vessel was being palpated here. Okay, so that is why answer to this question was posterior tibial artery. You can see this is the anterior compartment of the leg, this is the posterior compartment of the leg, and from here, from the posterior compartment, the artery should come here and cross here and travel, and then it should divide into plantar arteries, right? So this is posterior tibial artery, which is being palpated here. Now let us move on to the next question. Identify the arrow marked structure. Now this image is given, and we have been asked to identify the arrow marked structure, and this is actually bones. The structure which has been marked is bones. And now how to identify in the sagittal section? In the sagittal section, if you can see, you can, I think, definitely identify this is cerebellum, right? This is cerebellum. And from our anatomy knowledge, we know that cerebellum is present just behind the brainstem part. And it is behind the brainstem part, but the brainstem is having 3 components: midbrain, pons, and medulla, right? So cerebellum is behind midbrain, pons, and medulla. but just behind pons. So this elevated portion, this distended portion in front, just in front of cerebellum should be pons. Above it should be midbrain, and below it should be medulla oblongata. Okay, and medulla oblongata, this lower end will come out of the foramen magnum and it will continue as the spinal cord, right? So we can say these are the important structures that are visible in the diagram. Also, we can see this is corpus callosum and this is fornix. What is this? Is the fornix, and in between we have septum pellucidum. In between we have septum pellucidum, and this region is the region for the thalamus, and this is the region for the hypothalamus. To understand these, all the relevant structure that I have marked here, let me show you this particular diagram. Now this diagram that I am going to discuss is very, very important, because based on this diagram the questions are asked from the radiology, questions are asked from the anatomy, because this will give you a very clear picture of the arrangement of the structures, right? Now apply the knowledge that we have just now discussed. This is the cerebellum, right? This, to start here, this is the cerebellum, and just in front it should be pons, above midbrain and below medulla oblongata. Between pons, medulla and the cerebellum we have this ventricle, which is fourth ventricle, right? Which is fourth ventricle. And here you can see this is the corpus callosum part. This is fornix that we have learned. Between the corpus callosum and the fornix, this is septum pellucidum. Septum pellucidum is the midline between the two ventricles, two lateral ventricles. Okay. And what is this? Is the thalamus, and lower down this is hypothalamus. Alright, and these are the structures in the floor of the third ventricle. What are these structures? We can say this is optic chiasma, this one is optic chiasma, this one is pituitary stalk, this is mammillary body, and this part is the tegmentum of the midbrain. Alright, then what is this? This is the tectum of the midbrain, and in the tectum you have two colliculi, above and below. Above colliculi is the superior colliculus, inferior lower one is the inferior colliculus. Okay, so this image is important for us, and in this given question it was very easy. Just to simply, it was asked like what has been marked is the pons is the answer, B. Next question, let us move on. We come to this question now. Identify the area arrow mark structure. This arrow mark structure. Now this is the part here is called as anatomical snuff box, as we are all aware of it, and this anatomical snuff box is actually bounded by these tendons. Let me show you. See, this is anterolateral aspect where we have these two tendons, and posteromedial aspect we have this one tendon. So what are these two tendons? Abductor pollicis longus and extensor pollicis brevis. They make anterolateral boundaries. Posteromedially we have extensor pollicis longus. So if I show you all the tendons, we can see this one is abductor tendon, this one is abductor pollicis tendon, which is reaching up to the base of first metacarpal, and this one is extensor pollicis brevis, which is reaching the proximal phalanx of the thumb, and this is extensor pollicis longus, which is reaching again the distal phalanx of the thumb. Okay, so these are the different tendons making the anatomical snuff box. And what is the content of the snuff box? This artery, radial artery, and in the roof what is present is this nerve, superficial branch of the radial nerve. The superficial branch of the radial nerve is actually, if it gets compressed, it will lead to a condition called as chiralgia, right? So this is about the anatomy of this anatomical snuff box part, and now here this tendon has been shown in the posteromedial aspect, because this would have been this is posteromedial aspect, which has been given as a red arrow, but this tendon would have been like two tendons together, which are making the anterolateral boundaries. So here in this part we will get abductor pollicis longus and extensor pollicis brevis. but the marked arrow right now in the question, this red marked arrow is extensor pollicis longus. So that is why A will be the answer. Now, what action is done by the arrow marked structure? This is the question. What action will be done? Now, first of all, what is the name of the muscle? Now, we can see this image is given here, and this image we can see this is the scapula from behind, and in this part this is the spine of the scapula, right? So above the spine one muscle has been marked, and this muscle is eventually reaching the humerus, particularly onto the greater tubercle part, right? So this muscle is definitely supraspinatus muscle. This muscle is definitely supraspinatus muscle. Now supraspinatus muscle, what is the action of the supraspinatus muscle? It does the abduction of the shoulder joint. Initial abduction of the shoulder joint is done by supraspinatus muscle. So answer is C. But let us look at all the muscles here in this rotator cuff, because rotator cuff is one of the very important structure which is very frequently asked, right? So let us see what are the muscles in the rotator cuff and what are their actions, because depending upon their anatomical position, their actions can be understood really very easy way, right? Let me show you how. So here you can see this is the anterior aspect of the scapula where we have subscapular fossa. In this part we have subscapularis muscle which is approaching the lesser tubercle part. And behind we can see we have supraspinatus, infraspinatus and the teres minor. Supraspinatus above, this is the spine, right? So supraspinatus above the spine, infraspinatus below the spine, and teres minor, it is coming from the lateral aspect of the scapula. And all these three muscles are attached onto the greater tubercle part, okay? Supraspinatus, infraspinatus and the teres minor. Now let us see what will be their action. So here we can see this muscle which is pulling from front. So it will lead to medial rotation because the final resultant pull of the muscle is coming from the front. In a similar way, this muscle will be contracting from behind, these two muscles together. That means infraspinatus and the teres minor muscle. When these two muscles they pull from behind, what will they do? They will simply do the lateral rotation. They will simply do the lateral rotation. Now we have learned about the subscapularis, infraspinatus and the teres minor. What about the supraspinatus? When the supraspinatus muscle will contract, the pull will be from above, neither from front nor from behind. So final resultant pull will be not doing any rotation, neither medial nor lateral. So what will it do? It will do the abduction from 0 to 15 degree. That means initiation of the abduction, right? So this is the overall actions of the muscles in the rotator cuff group, and this is what we have learned, that in this particular question, because the supraspinatus was a marked muscle, so that's why answer should be abduction. Okay, now let us move on to the next question. Identify the type of arrow marked joint. Now what is this joint? First of all, what is the name of the joint? Here we can see radial bone, here we can see ulnar bone, and in between the two bones we have interosseous membrane. Try and understand. In between the nation we use the word international. In between the bones we use the word interosseous. So this is interosseous membrane in between. An interosseous membrane is a fibrous structure. Okay. So if the bones are held together with the help of fibrous tissue, this comes in the definition of fibrous joint. This comes in the definition of fibrous joint, and it is a characteristic property of the fibrous joint that they will not allow movements. Okay, we have the supination and the pronation movement, but those movements will take place at the superior radioulnar joint and inferior radioulnar joint. Middle radioulnar joint is a fibrous joint. Fibrous joint will not allow movement as such, and the fibrous joints are seen in the sutures of the skull. And here the word used for the particular this type of joint is syndesmosis. That is a peculiar word for it. Syndesmosis is the answer, which is one of the type of fibrous joint. What is symphysis and synchondrosis? These two are the cartilaginous joint. It does not belong to the fibrous joint. Okay. And what about gomphosis? Gomphosis is also one of the type of fibrous joint. It is the joint between the gum and the teeth. Okay. moving on to the next question, which joint helps in supination and pronation movement? Now again, this is a recall, whether exactly this diagram was there, I don't know. Some of the students have told that this type of movement was shown, so supination pronation movement is shown. I just now mentioned in the previous question that supination and pronation is done at radioulnar joint, but specifically if it is asked, superior and inferior radioulnar joint, which will allow the supination pronation type of movements. Now it belongs to which type of the synovial joint? Definitely if it is allowing this much free movement, this is supination pronation is type of free movement, okay? Such type of free movement can only be allowed by the synovial joint. Now superior and inferior radioulnar joint is definitely a free synovial type of joint, but what type of synovial joint? Because under the synovial we have different types, na? Pivot, saddle, ellipsoid, hinge, ball and socket, all these are the different types of synovial joint. So answer to this question is pivot type. And how to remember this? We can use one mnemonic. We can use one mnemonic to remember the pivot type. The mnemonic is Rupia. Rupia is our mnemonic. And what is the meaning? This RU is radioulnar joint, superior radioulnar and inferior radioulnar. So superior radioulnar and inferior radioulnar. And AA is atlantoaxial joint. So atlantoaxial joint which allows no movement. When we say no like this, atlantoaxial joint which is involved in the no movement is actually a pivot type of joint. And who will allow the yes movement? That will be atlanto-occipital joint. Okay. So this question is done. Let us move on to the next. Now some students on the other hand told that it was not given, the movements were not given, rather this arrow mark joint was given. But anyway, if this is given, again it is inferior radioulnar joint, either they can ask about the movements or they can mark the joint. So they are asking about the inferior radioulnar joint, the answer will be pivot only. Okay, and we have learned already about this mnemonic and other aspects. Let us move on to the next question now. What is the vertebral level for the plane at the red colored line in the image? Now look at the red color line where exactly it is present. It is just above the umbilicus. It is important for us to understand the position, because two planes can be here in the nearby region. Just above the umbilicus, and you can see they are present just below the costal margin. This is the costal margin is there, no? So they are present just below the costal margin, because just below the ribs it is called as subcostal plane. That is why it is called as subcostal plane, right? Because if I show you one of the plane passing here, then it will be passing across the costal part, across the ribs, particularly the 9th rib. Then this would have been transpyloric plane. Then this would have been transpyloric plane. But now the question has been asked on the subcostal plane. Now we started with the umbilicus as a reference. Why? Because umbilicus position is at the disc between L3 and L4 level. Let me show you this. You can see this is the umbilicus position at the disc between L3 and L4 level, and just above, that means upper border of the L3 vertebra, we have subcostal plane, and the lower part of the L1 vertebra, we have the transpyloric plane. These two planes are very close, but the difference is if the below the ribs it is shown or across the ribs it is shown. This will help you in identifying the planes. Okay. So in this particular question, because the subcostal plane has been asked, so answer should be definitely L3. And anyway, it is just above the umbilicus. Umbilicus itself is present at the disc between L3 and L4. Now, next, let us move on to this question. A patient underwent a surgery for submandibular gland, and during which the hypoglossal nerve injury occurred. And what will happen in this patient? Where will be the deviation? See, the deviation of the tongue to the same side, deviation of the tongue to the opposite side, or there will be protrusion of the tongue, and loss of the general sensation in the anterior two-thirds of the tongue. Now you see, when such type of hypoglossal nerve injury is there, definitely there will be deviation, but this deviation will be seen on protrusion. On protrusion, because when the patient attempts the protrusion, then there will be deviation. So let me show you this diagram that will give you insight here. When the normal aspect, like both the muscles are contracting together, then this will be simply protruded out in the midline. But suppose this muscle is not working, only this muscle is working, it will push across the midline and the tongue will be deviated towards the side of the lesion, towards the affected side. So that is why in this particular question, answer will be deviation of the tongue to the same side of lesion. But here what we have to understand, it will be deviation on protrusion. Okay. Next question is, the patient presents with the mandibular hyperplasia and the boy has hypodeveloped mandible and the small chin. This can be due to defect in. Now, indirectly they want to know that this mandible, chin, this region basically it develops from which arch. We know answer is straightforward, first arch, because the name of the first arch itself is the mandibular arch. So mandible and the surrounding bones like maxilla, zygomatic, all these bones, they develop from the first arch and along with malleus and incus. Okay, so this is the table which actually is very, very important for us. This is the table I have compiled from the Langman's book. Okay, this is the Langman's latest book, latest edition. And here what we need to know, everything about the pharyngeal arches. It's very, very important. We need to know the nerves, we need to know the muscles derivative and the skeletal derivative. You see the zygomatic bone, maxilla, the part of temporal, you see mandible, malleus, incus, all these bones are coming from the mandibular arch. So definitely it justifies all the features which is given in the question, right? And we need to know, as I said, pharyngeal arches in detail. And let us move on to the next question. A man had a fall from the height, landed on the outstretched hand. The patient was found to have a fracture of the clavicle. What is the most common site of the fracture anyway? See, we know that when you talk about the clavicle, what is the weakest point where the usual fracture, most common type of fracture is seen? It is that junction where the round contour of the bone meets the flat contour. That means we can say junction of medial 2/3 and lateral 1/3 should be the answer. So although this junction is described this way, but this is the previous description according to latest edition of the Gray's Anatomy. Now this junction is actually described as medial 3/5 and lateral 2/5. So the junction of 3/5 and 2/5 should be the precise, but in this question because 2/3, 1/3 has been asked, that is even fine. Next question is, child accidentally swallowed a toy while playing and bronchoscopy was done and observed obstruction or aspiration. So basically aspiration was there, and which of the following is most likely the site of aspiration? Now in this particular question, we have the child was playing, so we can assume that when child was playing, he must be in the erect position, isn't it? Very less likely that he was in the supine position and then he was playing, because you see, if the child is sometimes history is given, the patient is admitted kind of. If the patient is admitted, in that case patient will be in the supine position. So here we can believe it is the aspiration taking place in the erect position. In that case answer will be posterior basal bronchus of the right lower lobe, because this is the position, this is the most commonly involved segment in the erect position, and this will be the answer in the supine position. Okay, so we can believe because the child is playing must be erect position, so that is, otherwise the position has not been described. But usually for the supine position the history is given in the way like patient is admitted or something, so where we can assume the patient must be in the supine position, right? Next question is, identify the arrow marked structure in the section of the medulla. Now medulla has been given, and this answer to this question is pyramid. Now how pyramid? We can see the outline here. This is the dorsal aspect of the medulla where we have the rhomboid fossa. I showed you in the initial discussion of the cerebellum, bones. There we have seen the fourth ventricle. This fourth ventricle will be seen in the dorsum of the this medulla part, but in the anterior aspect or the ventral aspect we have the pyramids present. So here you can see this is how the pyramid will look like. This is how the pyramid will look like. This is the midline swelling in the ventral aspect, but laterally you have the olive part, and further behind it will be inferior cerebellar peduncle. So there are certain elevations on the medulla, right? And if you see this way, now you can see the markings. This is the anterior aspect where you can see the pyramid, and this is the rhomboid fossa. Fine. Now this question that identify the arrow mark structure. Now this is a kind of a section where we have to understand about the structures which are shown. So these are the lungs there. If these are two lungs, in between this belongs to, this part belongs to what? This belongs to mediastinum, because the mediastinum is the part in between the lungs. Now this is the middle mediastinum where heart is present. So we can write simply heart. We can see the chambers of the heart here. And behind what is marking, the blue color marking is the descending aorta A. And what is this marking in between that you can see? This marking is, this one marking is the esophagus part. This is the esophagus part. Now how to identify this? Let me show you this diagram. Here you can see this is the mediastinum, and this is like the plane. Above the plane we have superior mediastinum, below the plane we have inferior mediastinum, which is further divided into anterior, middle and posterior mediastinum because of presence of the heart, right? Now we can see that if you look at this way, if the section is taken at this level, you will get like what features? You will see the heart, you will see the esophagus, and further behind you will see descending thoracic aorta, and this is what we were getting in the picture. So we were getting the heart, we were getting the esophagus, we were also getting the descending thoracic aorta. Fine. So that was all, and answer to this question must be descending thoracic aorta. So that was all, dear students. These were the questions that I could get. Thank you so much, everyone. Best wishes. In case of any doubt, you can always ask me on this detail. Thank you, everyone.